is a disease that is caused by the Lassa virus. This Lassa virus is from a rodent, rat, is responsible for the transmission of this Lassa fever. Lassa fever, initially, when it starts with you, it looks like malaria. You have fever, you experience headache, you feel very, very weak, and you are not even able to eat your own food. It is very common in this our tropical area, especially West Africa. And it is a disease that we suffer from in Liberia. Initially, we used to have the Lassa fever bed to include Bone, Lofa, and Nimba. But unfortunately for us now, it has spread to three other counties, which are Magibi, Masorado, and Grand Bassa. So it's a disease that is very common. And let me be quick to say, with the coming of COVID-19, nobody has given notice to Lassa fever to rest. So we need to be conscious of this disease that is deadly. So as we have come to discuss it, let us pay more attention, because it kills almost like Ebola. So Lassa is caused by a virus.
Okay,
Maybe
well,
later on in the discussion we'll tell you where it came from and other things. But for now, it is a disease that can sometimes lead to bleeding.
bleeding from the nose, the
To the
mouth.
nose, from your mouth, from your ear, any of your mucous area.
Okay, thank you so much. Let us move to Mr. Atieri. Mr. Atieri, now you're working with Ministry of Health from the Africa CDC. What experience are you seeing in Liberia, especially when it comes to this disease and that of COVID-19?
Okay, thank you for the opportunity. Lassa fever is not new to our setting. It's never new. In West Africa, it's so endemic. Ghana recorded one. I'm from Ghana. Ghana recorded one in 2011. Benin has also recorded. We have Togo and Nigeria, which was the first country it was reported, has recorded several of them. And what is the reason? The reason is because of the way we manage our waste. If you look at the continent of Africa, you will realize that West Africa is the only section in Africa that do not properly dispose of waste.
Sure.
Yes, and like he was mentioning, we have the rodent, the mastomy rat, which is so popular in places where waste is poorly managed. Yes. My little experience in Liberia is that we are too focused on COVID, and we are paying less attention to other possible infections that may even cause severe mortalities in our setting. So the recent outbreak is a wake-up call for us to really strengthen our guard, especially with regards to case investigation, case management, and general IPC. Our communication, risk communication, must be up and doing. We must work assiduously with all the partners involved to ensure that we nip this in the bud. Thank you.
So I want to know from you again, this Lassa fever, like Mr. Garrison Kewan was saying, is almost similar to Ebola. I want to know the difference or the similarity between this Lassa fever with that of the current COVID-19, and maybe a little bit of explanation on Ebola.
Yes. There's not much difference. there's not much difference, except the fact that with COVID is more of an aerosol. You see, COVID transmission is mostly airborne, especially in an enclosed space where infection prevention and control measures are always loose. With Lassa, we have different types of infection, mostly from the primary source, which is the mastoid rat, which picks the infection from the dirty source and then shares it through its feces and then urine. So it passes through your food and then leaves it there. That's the primary source. But the secondary source is when an individual takes this food and he becomes infected and he goes about infecting others unknowingly. So this, the main difference is that this one is an aerosol and this one is direct contact. Yes.
Okay, so that's the difference.
That's the difference.
Okay, thank you so much. So let us now move to the young doctor. Dr. Yeckers. I will continue to call you doctor because I don't want to call you your graduation. So we're talking about Lassa fever. How can this Lassa fever survive outside the host?
Okay. So usually you have to look at the source, which is the reservoir of the virus. Now, when you look at history since 1969, when it was first discovered that this virus had been found in rodents, especially the multi-mammoth rat or the mastomys rat, you can see that once a rat is infected, this multi-mammoth rat is infected, the virus lives within the rat as long as it lives. Now, record states that the rat is able to transmit it as many times as possible, and the rat has the ability to multiply a lot. So it serves as a reservoir. So if a person is not maintaining his house, for example, you keep it dirty or you keep dirt within your house, and then your yard is not really tidy, your house now becomes a lodging place of these rodents. They come in, multiply fast, defecate within or on your things, your food, urinate on it. And what is sad is, by you coming in contact with it, by touching it or by eating a food that is contaminated with it, well, you will get it. So it survives within the rodent, but once you come in contact with those feces or excretans of the rodent, you yourself becomes the next host. So that's how it survives. So first, it stays within the rat, and then when you come in contact with the excreta, you become infected.
Okay, so in case this rat feces or urine is on this surface, I mean, how long will it take to affect another person? Does it survive outside the host?
Okay, so usually the virus stays within those excreta for a longer time. The normal incubation period within a host, for example, a human host, will be like 1 week to 3 weeks, which is 7 to 21 days. But on the surfaces, yes, indeed, is as long as the feces are there, once you touch it or you are cleaning, and then the aerosols from the cleaning dust goes within your nose, you will come in contact with it and then come down with Lassa fever.
Okay, thank you so much. Let us move to Mr. J. Garrison. Mr. Kenyon, let's look at this. With your experience at Ministry of Health in other working places, where you say if we were to continue this hand washing continuously, maybe we wouldn't have been at the stage we are in today with Lassa fever at the same time fighting COVID-19?
Yes, I think it is, though nobody has done a real research, it may be ongoing, but with the constant compliance of hand washing or hand hygiene, let me be more elaborate, because it may not only be limited to washing, it may be use of alcohol-based hand rubbed. With that, we have seen some good results. I was at JFK yesterday, and then we realized that what we once used to have as cholera units is no longer open, and we want to attribute partly to the good habit of washing hands. Because most of the time prior about this time of the year, we used to open the cholera unit because it is from hand to mouth direct transmission. So we are of the good opinion that with constant hand washing and adherence to all of the RPC protocols, the incident or the prevalence of Lassa fever will be decreased. Let's take for instance, patient coming to the healthcare facility. If you were to do the proper screening at the entrance of the facility by checking temperature, taking history, and if they are highly suspicious, you keep them away from the rest of the patients, you are likely to keep this infectious case in a contained way that can be managed without infecting other people. And we have, as a ministry, we have had it as a mandate that at the entrance of every healthcare facility, there should be screening, which includes the checking of your temperature. We just heard that one of the clinical signs or symptoms of this disease is elevated temperature, fever. So most of the time somebody may go and you are assuming that it is malaria only. There may be other things. So with your thorough investigation of the case that came in a febrile state, you will be able to know whether this case is a Lassa fever or not. Besides that, if all the healthcare providers and those who even handle food are following what we refer to as a WHO moment, before you touch a patient, cleanse your hand. After touching your patient, clean your hands. Before you perform a clean procedure like opening IV line on an inpatient, cleanse your hand. And when you shall have come in contact with body fluid from any source, clean your hand. And they even go as far as, if you don't even touch the patient, but you have played in his surrounding, immediate surrounding, which we refer to as a patient zone, cleanse your hand. Those are the kind of compliance that I'm talking about. If we do all of these things, as Carl mentioned, keep your environment clean. Many times you are sitting down, even doing in your home, the unexpected guest you see is the rats that go moving from place to place. Although not all rats transmit the Lassa fever, but since you don't know which one is which, it's better to just keep all rats out of your home. They are not welcome guests.
Thank you so much. Thank you so much for that clarification. Let us move to Mr. Carr and Thierry. Mr. Carr, Thierry, looking at your experience, and you were saying that we should clean our home continuously, especially you notice this virus is in West Africa, like Liberia, Sierra Leone, Guinea, and that of Nigeria. People talk too much about, the environmentalists, right? They talk about balance of nature and all that. Is that affect how we exterminate this rat?
Balance of nature?
Yeah.
Yeah. We like I said before, we have a history of poor waste management. When you go into town, especially areas that I don't want to mention, you will see waste completely dumped on the roadside, even sometimes choking the road, that the motorists are not able to use the road. If this should continue, especially in a cosmopolitan area like Monserrado, it will be very catastrophic. Yes, and we are looking at mortality of 1%. This is a sickness that is so insidious. The infection is slow. you don't take notice of it till you are completely broken down with liver, kidney, and spleen damage. So that notion of what you said, it really doesn't apply. It doesn't apply in my case.
Okay, because most of the time you see environmental preaching on save the environment, protect the animals, protect these things. So I was just thinking if maybe cleaning the environment, especially because these things come from the bushes, come to the dirty area and then penetrate through the home. So maybe cleaning all of this area, I was thinking if does that have any effect on our relationship with the environment?
Oh, really? Nature is there for us. Yes, and when science speaks, we must obey. When a research is conducted and they come out that okay, this in our opinion, for ecological reasons, you must do this, you must do that. That is the science that speaks, and it is backed with data. So, in my opinion, that we have to comply with that.
Okay, thank you so much. Thank you so much. Let us move to the young doctor in studio today. So I did a research or read about drugs. It is true that there is another drug that scientists says it kills Lassa fever. At least in guinea pigs for now, it seems to be better than the riba variants.
Okay, so I've been making research too as you, and I saw that they are developing immunoglobulins to help fight against the same Lassa fever or the virus that causes the fever. But for now, there are not a lot of evidence to prove it. You know, after developing a drug and then it passed through the phases, the drug is tested on a little amount of population, small people. So results from there, if they are positive, can be tried on, either entire population or a more larger population. So for now, the best of all still remains the riba variant. That is a new research and it seems good, but we're looking forward to hearing a time that is far more better, the riba variant.
Okay, Mr. Kenya, do you have anything to say about that drug?
Except that having the drug available even on the market is one thing, and as Liberians or West African having access to the kind of drug is it. And being a new drug, if it even begin to work, it's going to be expensive.
Okay.
So I think in my opinion, what we have available, which is considered to be the most effective, especially when you start the treatment early, we can continue to use what we have.
So how long does it take to treat this Lassa fever?
Clinically, when those symptoms disappear, then you can retest the patient. If the virus is absent from the system, the patient can be declared free. Because some of the challenges we do have is when the test is done, sometimes the result can be delayed. And if the result is delayed, then you are in doubt whether you are dealing with an infectious patient. I know one incident that a patient even got discharged before the result came positive, because he clinically started feeling better. So it also depends on your own immune system. As we say with COVID, whenever you have some of those pre-existing conditions, any disease that come on you, it has serious impact on your body.
Thank you so much. So if you're listening to us, we are live on the Memorial Health Talk platform, Facebook and YouTube. You can also call to share your experience and ask our guest panelists all of the questions you want to know about Lassa fever. The numbers to call and be part of the discussion is 0770-107-107, 0886-107-107. If you're outside Liberia and you want to be part of the discussions, you can also call our WhatsApp number or the Skype number +231-880 571-223. So the phone line are open. You can now keep your calls coming in while we continue our discussions. And the master call is 0770-107-107-0886-107-107. So you can call and ask our studio guests all of the questions you want to know about Lassa fever, or if you have Lassa fever before, what was your experience? How do you feel? Do you have any idea how you got the virus and what your doctor told you? So the phone line is open. You can now keep your call coming in. So now let's come back to you. We were talking about the treatment aspect. And now something just clicked to my mind. How can this virus be transmitted?
Okay,
Mr. Carl said it first, but I just want
Yes.
you to elaborate on it.
okay. We, as our incoming young doctor, Yeke said, the rat is a reservoir. It urinates, it passes feces, and when this contaminated food is taken in by an individual, this food contains this virus. That is the way you can contract it. So that brings to the point of keeping your food safe, closed. My experience is that sometimes when let's assume you have a piece of bread and you see mark of rat on it, they will cut that portion that has been eaten by the rat. But they forget to know that while the rat was eating, it urinated on another part. So the part that you throw it away, because I know things are expensive, but your health comes first. So it is when you are in contact with the infected food stuff. That's why in my introduction I said even food handler, those who prepare our food, they need to have basic idea on how to preserve it, how to keep it safe, because sometimes you leave food open, it is exposed. Rat doesn't go to the supermarket. They don't have farm. Whenever they farm food, they try to feed on it. And during the time they're feeding on it, it can get contaminated with their feces or urine. And if somebody unknowingly take this food in, that is the initial way you get infected. We even went as far as saying there is also human to human transmission. Somebody who is already sick, you are in contact with them.
Yeah, that's the place I was driving, because you're talking about treatment and you're talking about it depends on the time, right?
Yes.
So now if you have a baby mother that is breastfeeding, it is already have already been diagnosed with Lassa fever, can she breastfeed that child without transmitting it through the breast milk?
Well, let me, because this is in the bloodstream, I don't want to say yes, but whenever somebody is sick in that way, it is better not to. I will assume that, because breastfeeding, it is in contact with body fluid.
Sure.
So it won't be safe. I would say
Definitely
it
won't be safe. Yes, definitely it won't be safe, because once you breastfeeding the child, it may likely transfer to that child, and that child will come down with the same Lassa fever.
And besides that, Mama, the fact that this child is in direct contact with the mother,
The
because
mother
we say that
body
this is a
fluid.
contact transmission, is when you come in contact with the infectious shows. So the fact that the baby is going to be held by the mother to breastfeed, it makes it very unsafe.
Okay.
Just to touch on the ribavirin drug, drugs and vaccines basically follow about 4 to 5 stages in their chain of production, even to clinical trials. So the problem here is when this drug was manufactured, how was the trials done? Okay, in which population, in which area, where was the setting? You see, these are some of the questions we ask when it comes to drug trials. You remember when COVID vaccine came, there were a lot of concerns about the clinical trials. Yes, we saw that the trials were biased in one setting and was not done in another setting. So Africans, for instance, we are afraid to even take the drug.
Sure.
Yes. So basically, it follows about 4 to 5 stages. We must raise queries as to the processes, whether they were due processes that were followed through, and that is all. Thank you.
Okay, thank you so much. So if you're listening to us, the numbers to call is 0770-107-107-0886-107-107. If you're watching us live on Facebook, you can keep sharing this video, and thank you so much for joining us, joining the discussion. We have one that Stephanie, he said the Riba variant, which is an analog with the broad spectrum antiviral activities, has shown to be efficacious against both DNA and RNA viruses in treating acute Lassa fever. But this drugs has an off-label use of treating Lassa fever. Moreover, it is contraindicated in pregnancy due to the fact that it is teratogen. So, have you come across that? I think that's your friend.
Yeah, so the person is right, because for babies, in fact, that is why they are always warning when it comes to women who are pregnant, when it comes to the drugs they take. There are certain drugs that are toxic, or in a little term we say bad. When they use the word teratogenic, it means it causes a kind of genetic problem for the developing fetus, that in the end, the most likely outcome is death. If not, that fetus will be born with a lot of deformities that you as a parent, you won't be able to handle.
Okay.
So it is actually bad for the baby, so it won't be recommended for a woman who's pregnant.
Okay, thank you so much. Thank you so much. So if you're listening to us, the numbers to call is 0770-107-107-0886-107-107. If you're also Liberia and you want to be part of the discussions, the numbers to call, our WhatsApp numbers to call is +231-880-571-223. +231-880-571-223. If you're in Liberia, you want to be part of the discussions, the numbers to call is 0770-107-107-0886-107-187. If I'm too fast, the number is right on your screen there. You can also look at the screen and then call and share your experience. Call and ask our data, our studio guests, all of the questions you want to know about Lassa fever. So the phone line are open. You can now keep your calls coming in. So let us move to Mr. Garrison Cohen. Is there any complications in treating Lassa fever?
Yes, and this goes for many other infectious diseases. Lassa fever has a lot of complications, especially when it is not treated early. There are people who have recovered with deafness. That is, it accounts for about 25% of those who survive from Lassa fever. For some who had mild complication, in 1 to 6 months' time, they may regain their hearing ability. But there are complications, and one of the key ones, which accounts for 25%, is the aspect of deafness. So the more organs that get involved, that get damaged, the severe will be the complication. So my emphasis is on early treatment.
Okay, thank you so much. So could you take us through some of the signs and symptoms, especially the primary ones, that people should look out for in the first days?
Okay, thank you so much. So a patient who is having Lassa fever, first of all, should keep in mind that Lassa fever causes what they call viral hemorrhagic fever. Now, you may try to think, what is the meaning of that viral hemorrhagic fever? Now, this is a virus that usually attacks the blood vessels. And because of attacking the blood vessels, it causes what we call vascular permeability, increased vascular permeability. So there are a lot of molecules that should stay within the blood that start to leave the blood and enter into the tissues. So a person who is presenting with initial reaction due to the Lassa fever may first experience headache, They may experience fever that is very high because of immune reaction to the virus. But what is interesting is the body has a slow reaction to the virus. And that is why there is increase of molecules called cytokines that causes the fever to be so high. And another thing a person should watch out for, because blood is leaking through the vessels, when they look on their skin, they may start to see small dark patches they can call petechiae or hemorrhages, like bleeding, small bleedings. But at the start, they may have that feeling of vomiting, they may have fever, they may have headache, they may have weakness, they may have abdominal pain, they may even have pain in their joints. But as they progress, it may progress to back pain, chest pain, encephalitis, and bleeding from all the areas, the eyes, the nose, the mouth. And what is interesting is when a person sees that in one of their family members, they will not take it to be like malaria or typhoid. That is why for Lassa fever, it is something very important that once you start to suspect that a person is having a very high fever related to bleeding, quickly try to put in protective measures to your house. Isolate the person. Try to carry the person immediately to the hospital, and when you go, wear gloves, because it may lead to an outbreak if you're not careful.
Okay. Thank you so much. So we have so many comments on social media, on our Facebook page. From Dr. Stephanie again, he said to prevent transmission of Lassa fever, we need to practice basic hygiene and good community sanitation. Then we also have brothers for MOH from the lab department. He said Lassa fever is most often diagnosed by using enzyme-linked immunosorbent serologic ISA, which is the ELISA, which detects the IMG and the IgG antibiotic, as well as the Lassa antigen, reverse transcriptions, polymer chain reaction. So that guy is in the lab, so he actually speaking in laboratory team. So he said, where were I, sir? He said, which detail? Okay. Then he said, it can be used in the early stage of disease. The virus itself may be curtailed in 7 to 10 days. But this procedure should only be done in a high containment laboratory with good laboratory practices. So, he said it can be used to make a post-mortem diagnosis. So he just wrote a lot of laboratory analysis, but what he's trying to say that this virus can be curtailed in 7 to 10 days, but before that happens, it should be processed through a proper laboratory channel, right? We just get our sister Fatima Kurubali, who is just joining us. We have a lot of Facebook comments and Facebook people, so keep sharing our video. And the phone line is also open. I don't know why today, why you guys keep your call coming in, call and ask our studio guests all of the questions you want to know about Lassa fever. If you have been diagnosed with Lassa fever before, you can also call us and share your experience with us. Thank you so much, Burgess. Thank you so much, Dr. Stephanie. Thank you so much to Muhammad. Thank you so much to Ibrahim, Anthony, the Facebook people. I love all of you that are watching us on Facebook. Thank you so much for joining this discussion, and keep sending in your questions on our Facebook page. We read it live for you, and keep calling to share your experience with us. So now let us move to Mr. Ka Atieri. Mr. Atieri, working in Liberia, especially under this current situation of COVID-19 and then a sparkling outbreak of Lassa fever in the country. From your own analysis from the past countries you've been in, now you're in Liberia, also working as one of Africa Center for Disease Control person in Liberia, what recommendation will you give our government, our people, in curtailing this whole Lassa fever and that of our current pandemic, which is this deadly virus COVID-19?
Okay. Thank you for your question. when we talk about waste, it's about 80% government commitment, and let's say 20% of our households behavioral changes. You understand? We need to change our attitude towards waste and how we properly dispose of waste. I remember we recently had a meeting where we were told there was a dumping area somewhere around Starbase, and the Minister of Health immediately asked the assembly to move it. And as I'm speaking today, they are moving the waste. Today they are moving the waste. This is a clear example of the leadership we need. We want the government to be proactive. The municipal assemblies, the district assemblies, they should be proactive in collecting waste. On our own side too, our little households, our little homes, we should know how to properly dispose of waste. We should know how to basically that is it. That is it. Government should create avenues where there is proper management of waste, right from the collection to the commercial disposal. Yes.
Okay. And sometimes again you see our people, they will be like head about dump truck, like in each community, like from the Clarendon Bay where I live, like you will see a big hell of a dump truck to say, oh, put your waste into this current. And you will see some community dwellers will definitely put their waste on the sidewalk, either on the road or maybe just close to their sleeping bed. Yes. Because they are waiting for government to come and clean that site of the area where they put in the waste, which of course you have a very huge can to say, oh, don't be a waste here.
Thank you for that. In every setting, there are always the bad nuts. Okay, there are people who are sometimes recalcitrant, no matter the rules you apply. But in our local setting, we can charge or have a task force.
Sure.
We can empower them to do sanitation monitoring at our very locales. We can charge them with, we can even include them with the law to punish at the site where people misbehave. Yes, I think that would in the long run reduce this canker of Lassa fever recurring and all that. Yes. Definitely. Because it's purely a sanitation problem. It's just purely a sanitation problem. Yes. So going forward is behavioral change or the government commitment, total commitment to waste disposal. Yes.
So indeed, we have to change our behavior, our attitude, especially when it comes to our health. Because no matter what, your health is your wealth. No matter how poor you are, no matter how you classify yourself, but once you have a better health, a safe health, a good health, you live happily, you live longer, and you will always be protected from these viruses, the Ebola virus, if it were a person, the current virus, which is the coronavirus. Everything just talk about hand hygiene. Lassa fever, clean your hands, wash your hands, sanitize your hands. Coronavirus, clean your hands, wash your hands. Everything almost like have the same signs, the symptoms. You just got to check thoroughly. Because for Lassa, we're talking about bleeding from the openings. And for COVID, headache, Lassa fever too, got headache, severe headache. So you just have to wash up and always clean your environment, keep yourself clean, clean your dishes. Like Mr. Kanye was saying, when you see the bird is eaten by a rat, don't say, let me cut that part and eat the other part, because while eating it, the rat may urine on the other side that you eating, you feel like it is safe, it is not safe for you. So always learn how to clean your environment, always learn how to take a proper care of your food stuff, your dishes, your spoons. Each and every time you're taking these things to put it into your mouth, you have to clean them, you wash them thoroughly, and make sure that they are clean. So let us move to Mr. Kenway. Mr. Kenway, you've been working in a hospital for some time, also been on the field. I really want to know, how can this whole Lassa fever be diagnosed?
Okay, as you said, it's because sometimes our laboratory comes secondary. Based on your clinical symptoms, majority of our diagnosis can be made from there. Again, according to our Lassa fever management guidelines, it is said that whenever you treat malaria for the complete course of treatment and there is no improvement, take Lassa. If you only go by this, you will save a lot of life. Because the time you took malaria treatment, is not helping you, and you are doing your self-treatment, you will delay diagnosis. When the diagnosis is delayed, treatment will also be delayed. So the proper management of Lassa starts with early diagnosis. When you diagnose early, you initiate the correct treatment. That of dehydration, because you're not eating, loss of appetite, you get weak, can lead to complication. But if Lassa fever is treated early enough, first benefit, your patient will survive. The spread of infection will be limited because the source, the index case, will be identified soon, and the contact that you will trace will be on treatment or will be observed, so that when they start showing signs and symptoms, you can initiate early treatment.
Thank you so much. So let us move to the young doctor, Mr. Yeke. So Mr. Carr was just talking about the preventive aspect, how to clean our environment, how to take care of our food we eat, how to make sure that we have a proper waste management, and the government and that of the community dwellers should take full charge and responsibility of it. So I just want you to also brief on these preventions of Lassa fever.
Okay, so for prevention of Lassa fever, you first have to look at where can I get it. Again, like we said, you get it from those multi-mammoth rats. So to prevent your infection, what everyone in the community need to do is to keep their environment clean. For example, keep your yard clean, keep dirt far away from your yards. Now, within your house, keep your house clean. Now, if you have food, try to get a container that if you put the food inside, when you seal it, there is no way that rat can have access to it. Now, in a house too, there can be holes. It is recommended that you try to block those small holes on the ground so that those rats cannot come in. Now, if you already have the rats, you have things that can help you. For example, what they call on the market rat rumble. That is zinc phosphide. You can get zinc phosphide, also known as rat rumble, and set traps around in the house. You can get it along with the iron trap, where you set glue and then you put all those traps around to help get away of those rats. And what is more, some people even go to the least extent, get yourself a cat. Get a cat to the house so that the cat can eat the rat. And what is more important, personal hygiene. If you can wash your hands regularly, well, even if by mistake you touch something, a surface or excreta of those rodents, the fact that you wash your hands, well, your hands will be clean. Because what can be the problem is a person touch it and then put their hands in their mouth, and then you contaminate yourself. But if you can practice a good washing hand hygiene, you will help yourself. And sometimes when you are dusting surfaces that are already contaminated, we already get masks now. Get yourself a mask, because research has shown that by sweeping those surfaces that are contaminated, you can easily inhale the particles. And when you have a patient in your house who you think may be having Lassa fever, when you're trying to approach them, isolate them, and when you're going around them, use gloves. Then in case you carry them to the hospital, don't touch them with your bare hands. Doing these things will help you to protect yourselves from getting it.
Very well, very good indeed. Because we are not only focusing on the preventive aspect at home, But we're also looking at the hospital level. There's something they call nosocomial infection, hospital transmitted infection. You may not have Lassa fever, but there is a Lassa fever patient in the hospital. So if that patient is not handled properly, another patient may get that disease, in which of course the patient went there without Lassa fever. But because there were no proper care, the way you were saying, wear gloves, always make sure that you keep that patient safe from other patients before that patient body fluid or other stuff from that patient affect another patient. So you always have to wear your glove properly. You the hospital administrator or the nurse, health workers, whosoever, the nurse, the doctor, the caregiver too. You always have to protect yourself. We are saying this not only for your home, always make sure, because we learned that in Liberia, most students love gari. Like myself, when I was in high school, I used to like gari a lot. So when you buy your gari, do not put the gari in a plastic bag. Like where the people, when you go in the market, you buy, they will definitely put it in a plastic, either black plastic or some of these plastic that they can put the rice in. Then you just come and sit the gari down for the children. No, you have to look for a can and put that gari into the can, and before you. Good morning, your name and where are you calling from?
Hello.
Good morning, your name and where are you calling from?
My name is Saturday. I'm calling from Bonkabia.
Yes, everybody, welcome to Health Talk.
Huh?
Welcome to Health Talk. You are live.
Okay.
Oh, sorry. If you are listening to us, you can keep your call coming in 0770-107-107-086-107-107. We only have 2 minutes for call because we have gone beyond the time for calls now. So we only have 1 or 2 minutes for call. Also, if you stay listening to us, you can call and give your input. Better still, maybe you can join the show next week because time is fast spent and we're only here for 1 hour. Like we're saying, on the preventive aspect, you always need to make sure and protect the children gari, protect the children kanyo. Make sure you save everything. Good morning, your name and where are you calling from?
Good morning, Mama Wa, and good morning to your studio guest, the Charles Eke. My name is Sam N. Bonga.
Yes.
I just want to say thank you to the studio guest for his explanation, and I want to say kudos, and I'm following the discussion. Thank you.
Thank you so much. Thank you so much for joining.
Okay, so before we continue, something I wanted to add up. You talk about the hospital setting. Now, one thing that I would like to emphasize, especially for clinics, in a case where there is a suspected case of Lassa fever, it has been established that health facilities should immediately contact, for example, the state. It is important that they contact either MPhil or Ministry of Health so that they can come and get a sample. In fact, it is stated that lab that should be done should be minimum, because a lab for Lassa fever should be done in a kind of standard lab that can contain the virus so that it doesn't lead to an outbreak. So it is very important that any clinic that's suspecting Lassa fever immediately contact MPhil or Ministry of Health so that they can get a specimen and then do a complete test.
Okay.
Okay.
Thank you so much. And there's a vaccine for it, right?
Yeah, now they are producing a vaccine.
Okay.
It is on phase 2B,
Okay.
yeah.
Thank you so much. So time is fast spent. We should be closing this all important discussion. But before we close, we would like to hear your parting comment in that of your closing statement, Mr. Cartier.
Yeah, the last clinical trial for Lassa fever vaccine was in 2018, and we are hoping that there will be more of that before it's finally rolled out.
Okay.
Yes.
Okay. Thank you so much. And don't get your parting comment in your closing statement, Mr. Yeke, because against time now.
Okay, so in conclusion, I encourage all, especially those who are among the listening audience, to now take actions in the communities. Try to get rid of those rodents. So try to take steps to keep the house clean. Try to take steps to block the holes. Try to get rat rumble and rat traps, or even cats, so that we all can prevent ourselves getting infected. If we do so, we'll be able to help curtail an outbreak of Lassa fever.
Okay, thank you so much. Thank you so much. So now let us move to Mr. Garrison. Kawayan, can we get your closing statement?
Great. Thank you for the opportunity being here to discuss this very important issue. Before we take leave of you, I would just want to encourage the general public that we should continue to keep our environment clean, wash our hands before eating, before preparing food, and that whenever somebody is sick and you treat them for malaria or you take malaria treatment and it is not responding, think about other conditions. Don't treat yourself at home. When you go to the hospital, you have the opportunity to be tested in another way if malaria treatment is not succeeding. As we do all of these things and keep our environment clean, we are most likely to live a Lassa-free, Lassa-free environment. Thank you.
Thank you so much. Thank you so much for joining us. We want to say a very big thank you to our listening audience, to all of our social media viewers, both on Facebook and YouTube. And we want to say thank you to the Hot FM Female. This show is proudly brought to you by Honorable DJ Blue. We want to say thank you for giving our opportunity, for giving our time in studio to always discuss health issues that are affecting our respective community. We want to say thank you to the men behind the camera. Thank you so much. Do join us next week on another topic that we will be discussing. I think next week will be World Hepatitis Day, so we will also be discussing hepatitis in here. So stay tuned with us next week and follow the discussion, and I hope you keep your calls coming in next week because we'll be discussing one of the leading disease in Liberia, which is hepatitis. So thank you so much.